CVRS, an effective predictor for contrast-induced nephropathy after percutaneous coronary intervention. Contrast-induced nephropathy is a serious complication associated with percutaneous coronary intervention. Few studies suggest that CHA2DS2 VASC risk score is effective in predicting the risk of coronary artery disease in patients undergoing percutaneous coronary intervention. The aim of the study was to assess the efficacy of CVRS in predicting the occurrence of contrast-induced nephropathy in patients undergoing percutaneous coronary intervention for chronic total occlusions. Patients who underwent percutaneous coronary intervention for chronic total occlusion were included in the study. Patients who underwent hemodialysis, patients with glomerular filtration rate less than 15 ml per minute per 1.73 square meter, severe heart failure, and pulmonary edema, and patients who recently used contrast and nephrotoxic drugs are excluded from the study. The study included 239 patients who were divided into 3 groups based on the risk. The low-risk group included 64 patients, intermediate risk group included 135 patients, whereas the high-risk group included 40 patients. Incidence of contrast-induced nephropathy was considered as primary endpoint, and severe renal impairment that requires hemodialysis was the secondary endpoint. The incidence of contrast-induced nephropathy is greater in patients included in high-risk group as compared to patients included in intermediate risk group and low-risk group. The study concluded that CHA2DS2 VASC risk score is a simple, pre-procedural predictor for contrast-induced nephropathy in patients undergoing percutaneous coronary intervention in chronic total occlusion.